together. All right, now we do know that the best place for kids is in school for a number of different reasons. It is important for children to be in school. The CDC actually released a statement regarding return to school, and they had this amazing quote that was, aside from a child's home, no other setting has more influence on a child's health and well-being than their school, okay? There's a lot of risks to going back, but it seems pretty clear across the board once you get all the experts to weigh in that being in school is important, all right? So I want to take this opportunity to try to help parents do this the smartest, most effective way possible. The first thing we need to do is address the basics. There's some really simple things you can do at home as a parent to maximize your child's success with this new world of school and COVID, okay? The AAP has put out some really excellent information, but what we see over and over and over again is we want to maintain a routine. It's so important when things seem out of control for your child to have a routine, okay? We want the kids to be getting healthy meals and snacks. Quality fuel in means quality output, okay? We want those healthy meals and snacks for your kids. All right. We want them to get regular exercise, anything that gets them outside, away from the screens, in the sunshine, with the fresh air works. It counts. All right. Walks, nature walks, scavenger hunts, anything that's going to get your kid outside. Regular exercise is so important. And the last one is a normal, age-appropriate bedtime, okay? Let's keep these kids on a healthy schedule with quality food, good sleep, and exercise. That's going to do a lot for helping their mood, their concentration, helping them feel like they're in control in a situation that feels really out of control for everybody involved, okay? I would also recommend, and this is probably preaching to the choir, you familiarize yourself with what your school district is putting out. Okay, what are the emails? What's their plan? Take a look at what they're doing to keep your children safe, okay? What are their options? What are the options available to your child in school, part-time school, virtual learning? And what is the school gonna do if they see an increase in COVID cases, okay? And don't feel bad about asking questions. I mean, you're their parent, you're their advocate, okay? So get in there and ask questions. Don't be shy, all right? So the AAP and the Centers for Disease Control have put out a number of recommendations for schools to run safely. So I would recommend parents look for things like classrooms keeping the desks 3 to 6 feet apart, masks for everybody, kids and faculty, making sure there's lots of opportunities and supplies for hand washing, making sure the school is doing repeated cleaning and disinfecting of frequently touched surfaces like railings, doorknobs, faucets, stuff like that. And it's very important for your school to have a plan if there's testing needed for suspected cases, and then contact tracing after that. All right, so these are some things you can look for in the schools, okay? And for parents, I would recommend you really re-emphasize to the children that we need to wear our masks. I cannot underemphasize the importance of everybody wearing masks to just squashing this. You need to wear masks, everybody does, to prevent the transmission of COVID, okay? Tell your child it's very important to cough or sneeze into their elbow, okay? Don't cough into your hands and then touch everything, okay? Respiratory hygiene, very important, okay? Washing hands frequently, more important than ever, before we eat, after we play, after we use the bathroom, after we've coughed or sneezed. So important. And as much as possible, I know it's so hard, but try to keep the kids from touching their faces. I'm an adult and I have a hard time not touching my face. But it's important to re-emphasize that to the kids. One thing I feel like I haven't seen emphasized enough is the importance of children staying home if they're exhibiting any potential symptoms of COVID, okay? And what is that? What are we talking about? Fever of 100.4 or higher, sore throat, new cough, diarrhea, vomiting, or abdominal pain, or new onset severe headache, especially with fever. If your child is exhibiting any signs or symptoms that could be COVID, no matter how mild, please keep them home, okay? There's a really amazing document from the CDC that I'm gonna put on our social media, among other things. There's gonna be a image and info suite that comes out after this talk that talks about at-home screening for students, okay? Depending on how you answer, it could be anything from just doing the normal precautions that you would do any other year for a kid who has cough, cold, sniffles, up to we need to isolate and contact our PCM about testing, all right? So I'm gonna definitely give that to you guys. If your child is displaying any signs of illness, please keep them home, okay? Now we've got virtual learners. I've had questions about screen time, just trying to make sure I'm on time. I got a few more minutes. I've had a lot of questions about screen time, okay? Educational screen time does not count against screen time recommendations, okay? Lectures that you're viewing online, completing assignments on the computer, researching things on the internet, watching a movie or other media snippet for an assignment does not count against screen time, okay? That is educational material, that is active learning, all right? What we're worried about with screen time is the passive, swiping, playing a game, watching other kids assemble Play-Doh on YouTube, okay? That's what we're talking about with screen time, all right? But even if we're doing educational stuff, it is hard to sit and look at a screen all day, okay? So even with adults who work from home, all right, it's recommended that you do things in chunks. You do a chunk of work, and if it's possible, then you take a break. Intersperse that virtual learning with chore breaks, exercise breaks, reading breaks, and we are all, my kids included, consuming more passive screen time than we would like, okay? They did a good job today. It's hard. Give them a break. That's anything they want to do. All right, that'll keep them motivated and keep them focused and keep them sharp, okay? I know you're doing the best you can. It is hard right now, all right? You're doing a great job. And the last thing I would like to say is please have a backup plan, all right? We need the kids to go to school. It's very important, okay? We're trying to get the kids into school, but we've seen schools already within the first week of going back to classes have to quarantine a large number of teachers or sometimes switch entirely back to virtual learning due to a rising number of COVID cases within the school. All right, please have a backup plan for virtual learning, supervision, whatever it is. And I know it's easy for me to say. But it's important to have that at least on your radar because it is a possibility, all right? So this was my 10 minutes to try to synthesize a whole ton of information for you guys, all right? I hope I hit some of the high points. And if you have questions, I'm very excited to hear them, and I will do my absolute best to answer them in the Q&A period, okay? So thank you so much for your attention, and you guys have a great school year, okay?
Everyone, good afternoon or good evening, wherever you're from. I'm from California. A little bit about me, as Emmanuel has already told you. I'm an allergist, so I see both adult and pediatric patients, but I trained in pediatrics before I did my allergy fellowship, so that's where my heart really lies. So I take care, again, of both adult and pediatric patients, and I'm a parent as well, too. My twin girls are going to be 9 in a couple of months, so I know what it's like to be a provider and to be a parent as well, so I can hopefully see it from both angles. And thank you, Dr. Diano, for an excellent talk. So I will try to do my best as well, too, to answer some of the common questions that I see, and then hopefully give you some practical tips, and then we'll save some time for your questions in the Q&A. So one of the biggest questions that I get asked is, does my having asthma or my child having asthma put me at increased risk of getting COVID or having COVID? And really the answer to that is maybe, which I know is frustrating. It's frustrating as a provider, and it's frustrating for you because the honest truth is there just isn't enough data with many things related to COVID. We're learning. The information is almost constantly evolving, on a daily basis. There just isn't a lot of data. And if somebody had asked me this a few months ago, my answer would have been, what we do know is that having asthma doesn't make you have an increased risk of contracting the coronavirus. But what I and a lot of other people had thought a few months ago was that if you do have asthma, that might make you at higher risk of having a more severe case or having a harder time of recovering from COVID. Reason being is because asthma is obviously a lung disease. You have a pre-existing condition, a chronic condition. You may already have some pre-existing inflammation in your lungs going on. Again, that may depend on the severity of your asthma, how well controlled it is or isn't. But actually some newer data also shows, they did a large as large as you can get, 1,500 patients in New York who had asthma, who actually didn't have more severe cases of coronavirus compared to somebody who didn't have asthma. So that's why, again, I say the data is mixed. There may have been some subsets there based on whether you have allergic asthma or not allergic asthma as to if that may make a difference. So again, it's a maybe. It really is the answer. And one of my mottos is I always tell my patients, better safe than sorry. So you have to take a look at what those risks are that you or your children may face, and it's a judgment call on what risks are you willing to take, whether that's a really small risk or not. Some may be willing to do it and some may not. So there's a whole lot of variety there. So again, related to asthma, it's a maybe whether that increases your severity of it. It does not seem to increase your chance of getting coronavirus. In terms of tips that I could offer you in terms of going back to school, I think a lot of what Dr. Diano had mentioned, masks, amazing thing, we're here in the 21st century, and mask and hand washing are our #1 defense against a pandemic. You don't need anything fancy. You need to wash your hands and you need to wear a mask. So it's really as simple as that. I cannot emphasize enough of washing hands. And it's surprising. I know we have a hard time. We think little kids may not be able to do things, but I think sometimes maybe we don't give them enough credit. A lot of young children can frequently wash hands and keep their mask on. It just takes a lot of talking to, and we also have to lead by example. So we have to be doing those things as well and modeling those behaviors for them. So again, I cannot emphasize that enough. Some of the other things that I would suggest also is making sure that you're continuing your medications as that have been prescribed for you, especially when it comes to asthma, your controller medications. So now is not the time to sort of wean or maybe forget or let your prescription lapse. I've been telling some of my patients sometimes in the summertime when they're doing well, we tend to wean off some of their medications, but right now, I'm hesitant to do that just because we don't want them going into an asthma exacerbation and having to end up in the emergency room where they're exposed to more things. So schedule an appointment with your hopefully allergist or your pediatrician to make sure that you have everything that you need. Check expiration dates on your inhalers and your EpiPens. Make sure you're up to date on that. One of the other things that I can't emphasize enough is know your medications. Know which inhaler that you're on, not just the color. Your version of red or orange may be slightly different than my version of red or orange or blue, and I often get told, well, I was on the blue inhaler. That isn't always helpful to me. If you have a side effect from something, then it's hard for us to figure that out. So really just know the names of your medications. Know the expiration dates, call in advance for refills, school forms. It's really the bane of my existence at this time of year. School forms, you cannot imagine how much paperwork comes through my desk, but a lot of school forms, a lot of frantic calls this time of year. Oh, Dr. Patel, my child cannot start school until you fill out this form. So, have the form ready early if you can. Many forms are available to download online on your district's website, so you don't have to wait to get it from the school. fill out your part, fill out the name, fill out what medication you want for your child. I get a lot of blank forms. And sometimes, patients need 2 or 3 medications at home. So it would really be useful for me to know which ones that medications at school, excuse me. So it'd really be helpful for me to know which ones that you want the school form for. So as much as you can fill out and provide, that makes it faster for me to get the forms back to you. So there's less waiting going on. So those are some practical tips that I would recommend in terms of just having your medications ready, having your school forms available that you're able to take to school if you will be going to school. And I think really that's all that I had to say, and I will save some time for the Q&A, and I will hand it over to Dr. Scott.
Thank you so much, Dr. Patel. So first of all, I just want to say what a pleasure it is to have all of you out there in Cyberland joining us. We all know that, as you've heard from Dr. Patel and Emmanuel, as well as Dr. Dieno, that we are all going through a very challenging time and trying to get clear, evidence-based answers is rather difficult, especially in the information age. So for us tonight, what I hope to do is to be able to give you a sense of what our thoughts are, or what some of my own thoughts are about the information that is out there, and to make it clear, easy to understand, and then easy to translate into your own lives with your families. So again, a pleasure. So I think, to start us off, I think there has to be a disclaimer. And I think it's something that should really, umbrella over the entire talk tonight, which is that in regards to this situation, there is no right or wrong answer. So any amount of, guilt that you may be feeling about the decisions you're making, or anxiety about making the correct or the wrong decision for your family, I say throw it out the window and, focus this decision-making process on your unit and your family. And remember that you are all here because you are dedicated parents who want to be informed, have the, all of the information in front of you, and then to be able to make a decision as a family. And the truth is that every family is in a different situation. So put on your earmuffs when you're out there and ignore anybody else's opinion. And I hope that all the information that we convey tonight helps you to really come to a decision for your family. So, in thinking about COVID and its impact on our children, our families, we really want to think about a couple of different components. And I think the first thing that we want to be thinking about is, what are the actual stressors that your child has been under? Because as we see from our own experiences, from speaking with friends, family, the experience is so different for everybody. So for some kids, there has been this prolonged period of social isolation, which may have been quite a struggle for them, for a child who is rather social and connected. There have been other stressors, financial problems, financial strains on the family. Some families are struggling even to provide food on the table. So there are not only families who worry about getting food, but there are hungry families out there. With the return to school, we see all the ads, we've got Staples, Bed Bath & Beyond, everything. There are many kids who even accessing a pencil and proper supplies is a stress about returning. In addition to that, there are other even more significant strains on some families. We in mental health have seen that there has been an increased exposure to domestic violence in the home. And if we think about some of the most severe consequences of the COVID crisis, there are some kids who have even lost a relative or even a parent. So thinking about how our children are, going through this, what are the stressors that they themselves are taking on? And then also keeping in mind that there are some kids out there who are actually enjoying this very much. And as we move forward a little bit, we'll want to highlight some of those kids, because while, it may put a little bit of a smile on our face, there is also a population of children who their enjoyment can create quite a problem as we prepare to transition back to a school schedule, be it virtual or in person or some combination of those. Now, whenever we're talking about kids, We also have to think about ourselves as parents, right? And as Dr. Patel said, Dr. Diano, I can speak on behalf of, as well as Emmanuel, we are all parents. I myself have 2 young girls at home. I have a 1-year-old and a 4-year-old. So, we're preparing, and trust me, we're having the same discussions at home amongst ourselves in our home and with our families, and trying to come through all of this. So this does create some level of stress, and people are lying to you if they say that COVID has created no stress in their lives. Stress is normal. Stress is part of our lives, right? So being very much upfront with the stress that you as a parent have been under is very important. So thinking about, how you are coping, what is the plan that you have put into place for your own self-care? How are you communicating frustration? So are you sitting over, the dinner table talking with your spouse and oh, sorry, just getting a message from the boss. So are you sitting at the dinner table with your spouse communicating, your frustration? Well, you're much better off trying to put that into, into a conversation with a peer when children are not around. Now, who are the people that we want to pay particular attention to? So we mentioned we want to pay attention to our kids, pay attention to ourselves, but we also want to pay specific attention to the more vulnerable children in the population who are at higher risk for poor adjustment back to school. So who would that be? Well, that would be any child who has a known psychiatric disorder, especially an anxiety disorder, any situation where there may be challenging family dynamics at home. If we have a child who has experienced serious illness or losses, they're going to be especially vulnerable to graphic news reports or frequent media reports on COVID. The school refusing youth. So there are many kids who are highly resistant or just flat out refusing to go to school. So, being able to pay particular attention to that child's adjustment is very important. And the key in these situations of vulnerable children is gradual exposure, because what we're going to experience as that child is they're going to experience desensitization, habituation to the distress of returning to school. And what I mean by that is that with gradual reintroduction, as opposed to throwing them through the door and driving off in your car, is that you're going to allow their own thoughts and their actual physiological system to readjust to a very stressful thing of going back to school. An example, in a way that I like to put it into sort of more real life examples, is skydiving. So if we're talking about skydiving, some of you may have done many jumps out there from all different heights and atmospheres. Oh, we got one right there. I think Dr. Patel has. She has. All right, we got a skydiver. So, when you think about skydiving, you may be sitting with a friend talking about skydiving, and the more you talk about it, the more it can start to build up. And you may think about all the movies you've seen, all the television shows, the daredevils, the space jumpers, all those kind of things. And until you actually go and do it, what you're going to find is that fear may grow and grow and grow. And when you actually then expose yourself to it, so if you talk to a friend or a family member who has done a skydive, they may say, you land on the ground and you say, why haven't I done this before? Let's go again. So the idea here is that, if we think about avoiding things, right? Our children have been avoiding school. And for those particularly vulnerable kids who may have anxiety about school or social anxiety, avoiding it has allowed them to reduce their anxiety. Sure, they're kicking back, relaxed. However, at the same time, avoidance tends to allow that anxiety to build and build and build and build, so that as they prepare to go back, it may be a lot harder. So for that reason, again, right now their feet are on the ground. If we tried to get them into a plane right now to go skydive, that person who's really anxious is going to say, no way. So better process may be, well, why don't we go check out the planes? Let's go talk to the staff. Let's see what the parachute's all about, and really to work towards reintroduction. Some other recommendations that we want to convey to you all are in terms of how do we talk to our kids about COVID-19 and school. So in terms of talking with them, we don't want to force it. We want to be able to create an open, supportive environment. We want to be honest as well. We don't want to give false information, right? So some of the things that you've heard us refer to, such as fact sheets or information from the CDC or the World Health Organization, Get online, pull those resources out and put them on the kitchen table and sit around as a family and discuss the facts as opposed to, maybe some of the information that people are hearing from other people. We also want to be keeping in mind that we have to validate our children's thoughts, feelings, and reactions. Now, they may ask many questions over and over again. We have to understand that, that is okay, number one, and we want to show them not that we're annoyed that they're asking the same question again, but that we're curious. We want them to be heard. We want them, we really want to know what they're thinking. And that's really a general thing we want to think about with our kids. So again, we want to be reassuring, but not unrealistic, right? So letting them know that, there may be cases in your school that, but that people are going to be prepared for that. So again, setting up a very open environment is very important, and letting them know that, you are going to be there for them. First of all, the decision of what you do as a family, again, is your family's decision, meaning the entire family. Sit down with your children and talk with them about it. Remembering that most of this is likely to change as we even approach the school year, as things change in the country and in the world. To echo some of the things that Dr. Diano said, we want to establish a predictable routine. That is something that will help mitigate anxiety as we prepare to go back. We want to prepare them for the new rules that they may face in the school environment, involving social distancing, mask wearing, hand washing. If you have access to photos or videos of what your school will be doing, expose them to it, show them. That will help desensitize any fear that they may have. Explain the process that they may face when they get into school. For example, they may be eating lunch in the room instead of in the classroom as opposed to the lunchroom, things like that. Consider having kids meet their teachers virtually if your school district can accommodate that. For young children, a brief individualized introduction will be a big help. For older kids, maybe a small group of 5 to 7 kids, even virtually, is fine. And some other things before we do get to questions would be that we want our children to be highly involved during that initial return to school. And that goes back to validating our children. The more we give them a sense of control during this unpredictable time, the better they will feel and the better their adjustment will be.